Hello everyone, welcome to the new video. Today we have Olga here as our guest. So tell us what's bothering you and why you came in.
I have this discomfort in my upper left shoulder. When I sit or stand for a long time, it starts to hurt a lot, like a stabbing pain. I went to a neurologist and she told me that I have a slight curvature and that I also have osteochondrosis.
Well, so now we're gonna do an examination as usual, and then we'll have some manual therapy and a massage just before that. So let's see what we have here. So along the spine, placing fingers on the pelvic bones, go ahead and bend forward. So we see that there's a curvature of the spine slightly to the right-hand side, and there's also a bulge higher on the right side than she has on the left side. And come over here, please. Over here. So right here, we can see a displacement in the upper thoracic region. The vertebrae here are deviating to the left. The first thoracic, and 1, 2, 3, 4, and the fifth as well, the fourth and fifth. So straighten up and just tilt your head. So the first thoracic, the displacement goes to the left and it protrudes quite strongly here. So because of this, the entire issue is on the left side in this area, starting from the fourth thoracic vertebrae all the way up to here. They're all shifted in like a checkerboard type pattern, as we can see here. So specifically in the lumbar region, here it goes more, and in the thoracolumbar region, over here to the right-hand side. So this causes a difference in the legs, and that is a difference in the position of the pelvis. It's shifted over to the left, and that's due to the curvature in her spine. All right, so let's get started. As always, with the lumbar region, and then we'll move upward. Well, here it's not easy. So now, stretching. There we go. Now thoracic, from the lower thoracic to the upper. And now we're moving into the upper thoracic. So keep relaxing, just like this. All right, so now I'm gonna take the shoulder and relax. All right, so now our neck, relax. I'll do it myself. Relax. The other side. All right, very good. Let's lie down flat. Very good. You're like a special forces soldier, not making any sounds.
I don't know, these cracks are actually quite pleasant to me.
To each their own. So we have different cases here. Someone cries, someone enjoys it. It's, we have it all. Relax. So the ribs. Well, everything looks good here. Now, the sacrum. Well, good stretching, no issues here. So we'll check over here on the left side, on the other side. Relax the leg. And that's good as well. So now let's check the hip joint. Oh, everything's good here. And on the other side. All good. So now move your hips closer to the edge. Right over here. Excellent. All right, so put this arm underneath your head. Lower leg straight. Okay, and slightly like this. And to the other side. And we still need to work on the entire spine, even if the issue is in the thoracic region. So by correcting and working on the posture in general. And we're also going to need to work on the lumbar region. So hands behind your head. That's it. Relax onto me, keeping your legs in place. There you go. All right. Okay, now elbows together. No, leave like a resting space here. Very good. Now lie on your back. So now we're going to get to the neck. All right, so what's the issue here? The issue here is that the cervical lordosis is straightened. So you often kept your head low, and the cervical lordosis straightens. So due to this, the upper thoracic vertebrae are pushed, which we observed earlier in the beginning. So, very good. Very good. Excellent. A bit more. And take a deep breath. Exhale and relax. Here in the chest area too, when there's a curvature of the spine in the thoracic region, it leads to deformation of the chest as well. So we want to address that for sure. So now close your jaw and relax. Very good. Relax, relax.
That was also kind of pleasant.
This is called a good nervous system, which is in order, and the person doesn't suffer from excessive fears at all. So such a reaction is pretty normal when undergoing manual therapy. It happens all the time. So the hair's getting in the way here. So bring your elbows together, just like this. All right, so stand up. All right, so our main task now is to precisely correct the first thoracic vertebrae. So go ahead and stand over here on this mat over here, right over here, with your back towards me. All right, so press your chin to your chest like this. Yep, excellent. So now, take a deep breath and hold in your breath. Excellent. A stretch. Okay, so a piece of advice, try to keep your head as straight as possible whenever you can throughout the day. So don't lower your head like this, because in this way, you're gonna squeeze that seventh cervical vertebrae. So what sensations are you feeling now after that?
Well, it's okay,
Well, do
I
you
guess.
feel it in your head like a wave? Or like it
Probably
felt
more in
right?
the jaw than in the head.
Like a hit,
Right
right?
here.
Okay. All right. So now I'm going to show you a technique for correcting the first thoracic. Well, we might shake the arm a bit too, because the compression comes from here, affecting the whole shoulder and the arm. So we're going to be correcting the first thoracic. And it'll be just like this. So what you're going to do is you're going to put your hand here, just like this, and here, and this one here, 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 and sort of like lean your body towards me, like kind of just like this, like you're falling this way, just like that. All right, one more time. Relax your arm, like this, and like this, Here we go. Finally all set. Slowly relax and fall, fall, fall. Yeah, perfect. Now here, in the other direction. Also, straighten your neck up here. Relax. Relax, relax. Fall, fall, fall. And relax. All right. We also decided to stretch the lumbar spine because it turned out that your legs are also slightly numb. Mm-hmm. So straighten out your legs. Mm-hmm. Relax. Uh-huh. Very good. Uh-huh. Mm-hmm. Now let's see what we've achieved here. Well, within the fourth and the fifth, we've managed to work and it's not protruding as much. And it's also not shifted to the left anymore. And it's much better right here, but the protrusion of the first thoracic is still there. So at least that's what we did. So straighten your head. Mm-hmm. At least we need to gradually work on it. And in order to relieve the spasm, it's going to take probably another 3 or 4 sessions with me. But that's pretty normal. Mm-hmm. So go ahead, relax your hand. Very good. It feels like you're on the chiropractic table every day.
A very pleasant tremor in the hand. Right here.
You gave a sensation, right? And it's like a neurological reaction. It feels like you're on the...
Yeah, I know. Sometimes it just happens. My hand will just go a little bit numb.
Yeah. That's the compression precisely in the first thoracic. Because of this innervation in the arm, and it's disturbed and numbness, it'll happen accordingly. So, all right, so relax this hand a bit. Uh-huh, very good. Is there a reaction over here?
Uh-huh.
Good. So now in the wrists. Let me give me this hand. All right, very good. So, alrighty, we're done. So how does it feel to be on the chiropractic table every day?
No, it's my first
time?
Yes, honestly.
Well, that happens. Actually, a completely good nervous system, no fears. The person calmly goes through every single procedure without even a flinch. So, Miss Olga, why don't you go ahead and tell us how you're feeling now after this?
It feels like my back has become completely light.
It's feeling like lightness, right? Mm-hmm. Very good.
Like a weight off.
Like some weight off. Alrighty, some weight off and time to drift off.
Thank you.